Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're taking a quick look at a new announcement coming out of CMS about the SHOP exchange. Now before we get started, we do have a couple links associated with this webcast, and you can visit those at any time by clicking on that information button you have at the bottom of your screen. You can also send us an email. Now this is an announcement that came out of the Centers for Medicare and Medicaid Services this week that says that the center is going to stop managing SHOP exchanges. SHOP exchanges were those exchanges to buy insurance unique to small businesses. It was run separately from healthcare.gov's exchange for the individual market, where individuals could go and buy insurance for themselves or their families. There was a separate exchange where small businesses could go to buy insurance for their company, for their employees. This was set up in a similar fashion to healthcare.gov as a one-stop for small businesses to go to find what their available insurance options were. Now, small business could also go to agents and brokers to buy their health insurance plan. And they could also take advantage of things like tax credits and reimbursements that came from the feds, even if they went through a separate agent or broker, as long as they bought a plan that was offered through the SHOP exchange itself. So this announcement came out of CMS that says, okay, as of January 1st, 2018, no more SHOP exchange itself. You're just going to have to go and use agents and brokers exclusively. We're not going to make this portal accessible to anybody. They said it actually gives consumers more choice if they just go use agents and brokers instead. The rationale is a little fuzzy, but we'll talk about that in just a minute. They will continue to determine eligibility for the small employer tax credit. That will still happen. And small businesses can still buy a plan that might otherwise have been available from the SHOP exchange. But the difference is there's not going to be a central portal to handle enrollment for employers or to process premiums like there was in the past. Employers will have to go directly to an insurance agent or broker to handle that now. And of course, make sure that you pay a nice commission to your agent or broker. One of the exclusions of using the SHOP exchange exclusively before was that there was no commission that was available. Now, the ACA requires an establishment of a SHOP exchange as part of the federal law. And this is where the rationale starts getting a little bit fuzzy. Does CMS actually have the authority to decide they're not going to follow this part of the law anymore by just issuing a policy announcement? I'm sure we're going to hear a little bit more about that later. Some healthcare advocates and experts have been weighing in as well, saying, well, if you get rid of one of the options for how an employer could actually buy insurance, are you really offering more choice or are you limiting the choice? That's something else that's going to be hotly contested moving forward. The takeaways from this are a couple. There are still plans available for small businesses. Small businesses can also take advantage of tax credits by providing insurance for their employees. That is still going to be a thing. What's disappearing is the portal and the one-stop shop to help employers make that plan purchase. You can read a little bit more about the press release that CMS issued announcing their change. They, again, call this flexibility for states. You can read that on the link that we have available. And you can also read, we're sharing the Health Affairs blog on this topic. They look at it a little bit more and they make some of those arguments about the legality of CMS just getting rid of this by press release instead of by legislative change. You can read up on that yourself too. Thanks for joining us for this video case tip.